welcome back to the Humble Healer podcast. Today, this is Dr. Quang Lê, family physician. Today, we'll talk about, continue with the series of home medical care tricks, tips and tricks. And this particular segment is about public medical emergency in the public settings, which hopefully nobody will run into, but I'm trying to educate my community to be more ready when these things happen, and unfortunately they do happen. And I also am just fresh from ACLS and BLS, which is basic life support and advanced cardiac life support. So I still have fresh memories regarding what to do, and I'm gonna have a separate segment on that. And the BLS is important, and anyone can be trained to do that easy and get to EMS to start their ACLS maneuvers and so on. But today we'll talk about poolside resuscitation or drowning, which unfortunately happen also and can be very catastrophic for anyone involved, especially family members and friends and anyone who witnessed. Poolside drowning usually involves asphyxiation or laryngeal spasm, where the water just fill up your airways, causing your airway or vocal cords or larynx to tighten up, causing you not to be able to breathe. I did witness in the Navy where one of the corpsmen actually rescued a Marine with this problem. It's almost similar to the dry drowning. And then another one when I was also in the Navy, but spending time at the beach, where I witnessed somebody else and was involved in the resuscitation of a victim and who turned out to do okay, but this could happen. So this particular case is about true story, and it's from the emergency medicine review and perspective, which is one of the main medical editors for the famous HBO show, The Pit. They provide all the medical facts and cases for the show, which is extremely medically accurate. So the case about a physician who was at a public pool where her two children, 3 and 5, were taking swim lessons. And suddenly she heard a loud whistles and saw that the lifeguard jumped into the water and pulled out an adult male to the surface onto the edge of the pool. And she ran to the poolside and introduced herself and offered help. And the victim was blue and not breathing or moving spontaneously, and there was no pulse. So the physician started compression within 2 seconds of him being pulled out of the pool. And with the first compression, water and white foam started pouring from his nose and open mouth. And more came out with each compression. So, it's obvious that the victim swallow a lot of water, and he probably had emesis or vomit with the water, and that's why it explains the foamy appearance of what came out of his oral cavity, and that also prevents him from being able to breathe. It caused him to be blue and not breathing, and also having cardiac arrest, at least lacking not any pulse. So another lifeguard arrived with a one-way valve mask, which is also important, and started ventilating the victim. Of course, it's hard to do mouth to mouth when there's a lot of foam and vomit coming out of the victim, which can be a challenge in another real case without this one-way valve mask. But in this case, they do have that. So that allowed them to do that ventilating, or at least you can do the mouth to the valve mask over the patient's or the victim's mouth. And that is very important in any drowning case, because the inability to breathe is the main cause for the cardiac arrest. After a period of time, both the physician and the lifeguard stopped and did a pulse check, but still found nothing. So they resumed CPR with chest compression and ventilation. Another period came, and the victim seemed like he was moving and trying to breathe, which I'm sure it would have felt like an eternity when you are involved in the rescue. But it's good that this man was able to, or trying to breathe again. So they stopped compression, but it was not clear there was a pulse present. So they resumed CPR again. And a few minutes later, the victim regained spontaneous respirations and a pulse. So he was rolled onto his side and to evacuate all his foam, emesis, and liquid from his oral airway. The physician then was sweeping his mouth with an ungloved hand, and oxygen tank arrived, and oxygen mask was placed over his face and continued to intermittently clear his secretions. At that time, I'm not sure if anyone had any suction, but they were trying to clear his secretion to help clear the airway. The physician then gave the report to the emergency medical service, EMS, and sent him off to the emergency department. So the story at that time was that the victim was doing free swimming while his two children, aged 7 and 9, were taking swim lessons. Suddenly, among the loud chaos with all the swimming students, people overheard the kids screaming, "Daddy, wake up! Daddy, wake up!" On the way home, the physician called the local hospital and talked to the treating physician there and found out that the patient was awake and talking to his family and was hypoxic, which means he had low oxygen level due to significant lung injury and was on high flow oxygen treatment, and he was being admitted to the ICU intensive care unit. So from that story, there were lessons learned by the rescuing physician after she went home and did some reflection and studying, and which is a really great idea, is that she did a great job for sure, and the other people saved this person's life, but she still wanted to study and see what else she could have done better, and she could have used those lessons learned to educate the whole urgency medical service providers at any level. So that was great that she did that. And also it helps to reflect and be able to express and talk with others about the experience, since people can be traumatized by the experience. Not her herself, since she was an emergency physician, but for the people involved, like her children and the bystanders and so on. So first, in any public medical emergency in the public settings, see if there's any other healthcare professional to help. First, you introduce yourself and your credential, and then your training. So that way people know your capabilities, and then see if there's any other healthcare professionals that can help you. So at the time, there was a nurse there and also a psychiatrist. And the psychiatrist was key in helping with the crowd control and retrieve the oxygen. He also was instrumental with debriefing the children afterwards. He also checked in with the victim's wife when she arrived. It was a traumatic experience for everyone, and the physician was probably the only person that had witnessed a cardiac arrest victim. So it takes time to process the events emotionally for yourself and your loved ones if they also witness the events. Get support if needed to help deal with the emotional impact of the event. One lesson that I have learned also and trying to teach other healthcare professionals during the COVID pandemic, a lot of healthcare professionals and physicians struggle since they dealt with these traumatic experiences on a daily basis and did not have the time or take the time to reflect on these traumatic experiences, and eventually these mounted up to the point that causing a lot of burnout among healthcare physicians and healthcare providers and physicians, and some with tragic endings, unfortunately. So it's important to reach out to other healthcare providers and so on after a traumatic event to make sure everyone is okay, and if they have any question. So lesson number 2 is that this victim dropped and died in 3 feet deep of water with lifeguard only 15 feet away. So we know that we learn a lot of shallow water drowning, especially among toddlers, which is so tragic, that drown in the bathtubs without proper or close adult supervision. So you can put face in the water with shallow water and you can still choke, especially with toddlers that don't have a lot of great balance, not being able to prop themselves up to breathe. So apparently what happened was the victim liked to see how long he could hold his breath under the water, and he may have passed out or taken an involuntary breath inhaling water. And this is a game that I have done many times with my children, and unfortunately sometimes these things happen in shallow water. So it's something that to be mindful when you're in a public swimming setting in the future. So number 3 is in drowning victims, oxygenate first. So most of these cardiac arrests occur due to hypoxia, low oxygen, from lack of respiration. So you prioritize getting oxygen to the victims first. But there's always the importance of performing CPR, which is point number 4. But you perform CPR with breaths to give respirations because that is the cause of the cardiac arrest. And one can do, this is a BLS right here, basic life support. You do 30 chest compression to rescue breath ratio. And in this victim, there was a lot of mouth secretions as a result of the compression, which is a good thing because it was helping clearing the all the substance from his airway, but it can also interfere with appropriate respiration and ventilation. So it was very good that the guard had some sort of a mouth guard to help provide mouth to a breathing guard for respiration to help the victim. One can also consider turning the victim to the side briefly to evacuate the secretion before rescue breath. Lesson number 5 is, should we use the automatic electrical defibrillators, AED, for short. And the victims are wet, so make sure only use after drying them off to reduce risk to the rescuers also. But again, in this case, oxygenating is more important than AED in drowning rescue. And we'll talk about the importance of AED in other public health emergencies in the future. But in this case, oxygenating is the key. Number 6, consider cervical spine protection is rare. Also, rewarming of the victims and do not pronounce until victims are warm and are dead. So that's the key, is that a lot of time when they are cold, they could have co-induced cardiac arrest. So make sure you warm them up first before pronounce them. And then if there was some trauma involved, then consider protecting the cervical spine too. And also there's a recent article from American Heart Association, and American Academy of Pediatrics. They talk about drowning and resuscitation in children. And unfortunately, this accounts for 1 out of 14 unintentional deaths worldwide, and leading cause of unintentional death in children less than 5 years of age, and the second leading cause in children ages 5 to 14. There are preventable actions that one can do and recommended by AHA and AAP involving more than 90% of drowning are preventable. So the top 5 preventable actions are having 4-sided isolated fencing around swimming pool, which is the law in Massachusetts that I know, and then have approved life jackets. Very important also. Swim lessons, especially for children and non-swimmers. Can't emphasize this enough. Being able to swim is a great skill to have for anyone and can save lives and remove the fear of water in people. So get people in the water and get kids in the water with close supervision and just let them enjoy. And then once kids learn how to hold their breath under the water, that's a big step up. But the best way to teach a kid to swim is exposure to water activities. The more, the faster they'll learn, but that can save their lives. So consider swim lesson like the physician in the story to get your kids to any sort of water activities and teach them to survive in the water. A lifeguard supervision is important also if adult supervision is key, and especially keep your eyes on those weak swimmers and also non-swimmers in and near the water, because they can also trip and fall into the water and struggle. So those are preventable actions. And then recognize distress and provide flotation. So approach a drowning victim in the water can create a second victim if panicking person pushes the rescuer down. So having a flotation device can be very essential in rescuing a victim, especially in open water. Anything you can get that they hold on to hang on. Sometimes if people are dragging you down because they panic, one can do is you can actually take a dive under the water and they will let you go. And then you go back up on the surface and you try to find a way to help them too. Otherwise, you will lose 2 victims instead of 1. So you can activate the emergency, get some floating device, and then try to get the victim again. Remove victim from the water when safe. Remove them horizontally if unconscious and vertical if conscious. Provide basic life support and advanced cardiac life support, ACLS and BLS. Less than 1% of drowning victims involve cardiac arrest. So prolonged time in the water without rescue breathing can lead to cardiac arrest, like the victim that we talked about. In water rescue breathing, when appropriate, has shown more favorable survival rate and neurological outcomes. Rescue breathing is essential in any resuscitation effort since hypoxia is the immediate consequence of drowning. Hence, rescue breathing is prioritized over the use of AED with or without chest compression. So that's important, and we talked about that. Same here with fusion, drowning, and resuscitation. So hopefully this will be helpful the next time if you do with this drowning incident or accident. Introduce yourself, your credentials, your training, and get started with helping the victims right away. When I was in North Carolina, there was a middle-aged gentleman that was losing control and started to become unconscious. So a couple people brought him to shore, and I came over. I was a medical officer for the Navy at the time. Introduced myself, and the victim was after some action, not CPR. He was actually starting to move spontaneously, and then shortly after was breathing spontaneously. Very shortly after. So we didn't have to do any chest compression, fortunately, and did activate the emergency medical service, and they took him away for observation. But this could happen in any public water activities situation. So be aware and hopefully learn these lessons that we talked about today. The second one is when I was in the Navy, there was a Marine that was playing. Actually, he wasn't involved in a combat, but he was playing around with his buddy, and they were joking each other, and he ended up developing laryngospasm where he couldn't breathe. So it's like they call drowning, where it wasn't involved water, but because of trauma causing the larynx to spasm up. And so the on-duty independent duty corpsman IDC he intervened, and he put an airway into the Marine's larynx and provided ventilation past the point of the spasm, and were able to save his life. And later on, he was taken to a higher level of care, and they put what we call tracheostomy, temporary tracheostomy for him, and he did well after that. So this could happen. I want to raise awareness and help, so that way when these happen, you at least have some idea about what to do and what you can do to help. And I hope you find this helpful, and thank you for spending the time with this episode, and have a wonderful day.